rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello, everyone. Today I saw a patient who had recently been diagnosed with clinically localized prostate cancer. He asked, "Doctor, how high is my prostate cancer risk?" Rather than looking at just one finding, let's take a closer look. Our patient is a 69-year-old man with newly diagnosed localized prostate cancer. His pretreatment PSA level is 24 nanograms per milliliter. The prostate biopsy shows a Gleason score of 8 or higher. His clinical tumor stage is CT2C. Let's assess this case using the D'Amico risk classification calculator in the OncoToolkit. The D'Amico risk classification is a clinical risk stratification system for localized prostate cancer. It uses 3 pretreatment factors: PSA level, biopsy Gleason score, and clinical T-stage. The final risk group is determined by the highest risk feature present. Let's enter our patient's information. First, enter the PSA level. His pretreatment PSA is 24 nanograms per milliliter. So we'll enter 24. Next, select the Gleason score. The biopsy shows a Gleason score of 8 or higher, so we'll select greater than or equal to 8. Finally, select the clinical T-stage. This patient has clinical stage CT2C disease, so we'll select CT2C. Now click Calculate Score. Here are the results. The patient is classified as high risk according to the original 1998 D'Amico risk classification. In this case, all 3 variables meet high-risk criteria. The PSA is above 20 nanograms per milliliter, the biopsy Gleason score is 8 or higher, and the clinical T-stage is CT2C. Each of these features independently places the patient in the high-risk group. To see how the result was determined, expand how this result was calculated. The calculator applies the highest risk feature rule. For this patient, pretreatment PSA, biopsy Gleason score, and clinical T-stage all control the final classification. The final result is therefore high risk. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. If you'd like to learn more, scroll down to the reference data below. The original D'Amico classification separates clinically localized prostate cancer into low, intermediate, and high-risk groups using PSA, biopsy Gleason score, and clinical T-stage. The classification was originally associated with post-treatment PSA failure. The clinical workflow section provides additional guidance on how the results should be interpreted in clinical practice. This classification is a historical risk stratification system and should not be interpreted as an individualized survival estimate or treatment recommendation. Modern prostate cancer management should also consider contemporary grade group, imaging, disease extent, patient health, and current clinical guidelines. The D'Amico classification provides a simple way to organize pre-treatment prostate cancer risk, but treatment decisions should always be individualized. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.